Welcome to this series of lectures in oral medicine. We start this one at the beginning with extra and intra-oral examination. Extra-oral examination begins with initially with the entry of the patient into the consulting room, and you can review things such as gait, any limps or asymmetry of the patient. Once they are sitting in front of you, you may be able to, during the examination, after taking a history, look at pupil size, and this may be an indication of various things such as anxiety, drug abuse, trauma. Conjunctival and facial pallor may indicate anemia. Rashes may be also present, and that could be an indication of such things as allergy, which might have a generalized presentation, infection, which would be a little bit more localized, or things such as alcoholism might be also generalized. Redness. Swelling may indicate infection, an immune problem, which is systemic, or a neoplasm. And we all know to palpate the salivary glands and the neck nodes, and swellings in these may be an indication of either gland involvement directly or indirectly, as in a neoplasm. The cranial nerves can often be examined, and depending on the presenting complaint, this may or may not be done as a routine. But you can look at the cranial nerve examination PowerPoint and video to get a better understanding of the cranial nerve examination. In oral medicine, we may also examine the ear, not to diagnose any problem, but to see if there's any obvious problem that may be there and that would warrant further referral to an ENT surgeon or the general medical practitioner. Here are examples of what an otoscope might look like and what it might show in the ear. Intraoral examination, information on this can be gained from the exam history and diagnosis lecture. So in general, the process of diagnosis involves the taking of a proper history, which would be the medical history, and that could give you an indication of medications and or medical conditions that the patient may be suffering from, which may have a direct impact on either your management and or may give you clues towards the final diagnosis. Social history may give you an indication of cultural issues and or habits such as smoking or alcohol intake. And most importantly, the history of the complaint will be paramount for your diagnostic process. And this is especially so for chronic pain problems. The extra and intraoral examination, as outlined in this lecture and in the intraoral examination lecture, will allow you to then come up with a differential diagnosis. Special tests such as blood test, biopsy, and imaging is then used to reduce the list of differential diagnoses and to confirm one final diagnosis. You can get further information on the biopsy technique and biopsy video, and also imaging in subsequent lectures. Once a diagnosis is established, then the treatment plan and further management can be instituted. It is important sometimes to learn about some of the descriptive terms that we as a profession uses, and the use of these terms allows us to be more professional in our description and discussion with other colleagues. Sometimes more lay terms may be used when you're discussing these with patients or the public, but I think with other colleagues, it's important to be able to use terms that are professional. Thank you, and just follow through with the rest of the lectures in this module and the other resources to gain a good understanding of the history examination special tests, allowing us to formulate a diagnosis. Because without the diagnosis, proper management cannot occur.